Does blood flow restriction training actually help to increase outcomes in your recovery, hypertrophy, and strength? Well, let's find out. So BFR, or blood flow restriction, is a technique that utilizes a cuff to create a tourniquet effect so that you can perform low intensity exercise and get the benefits of high intensity exercise. BFR can be a pretty useful technique for people who are post-operative and other populations that can't really perform high intensity exercise. This allows them to perform at lower intensities and to gain the same benefits and to speed up that recovery. So let's dive a little bit deeper and understand how BFR actually works and the mechanisms that help to improve the hypertrophy, strength, and recovery. To start off, let's talk about hypertrophy. So the two main factors that help to promote hypertrophy include muscle tension and metabolic stress. When a muscle is placed under mechanical stress, it results in an increase in anabolic hormone levels and the activation of myogenic stem cells, resulting in protein synthesis, which is required for hypertrophy. And the myogenic stem cells are responsible for the recovery of any damaged muscle fibers and for the growth of the fibers as well. Another proposed effect of BFR is the production of HGH, or human growth hormone, which helps to increase collagen synthesis and aids in muscle recovery. And although HGH doesn't necessarily directly cause hypertrophy, it still helps to aid in muscle recovery and potentially improve muscle strength. And it's important to note that an increase in lactate and hydrogen ions from training also increases the HGH levels in the body. And because BFR simulates a high intensity environment, it also helps to downregulate myostatin, which controls and inhibits cell growth and muscle hypertrophy. So this creates an environment that allows more hypertrophy. Since BFR creates a hypoxic environment, it helps to activate the hypoxic inducible factor, resulting in anaerobic lactic metabolism and the creation of lactic acid. So to summarize all of that information up in a simple way, BFR cuts the circulation to reduce the oxygen to the area in order to simulate the production of muscle hypertrophy. Because when you're actively doing exercise and you're contracting those muscles over and over again at a high intensity, there's less oxygen going to the area and resulting in a cascade of events that help to promote muscle hypertrophy and strength. So now that we've gone over the theories of how BFR works, let's go ahead and talk about the research. So in the end of the day, BFR can be effective, but there's low to moderate evidence that it can help to increase hypertrophy and strength any more than regular high intensity exercise in healthy, active individuals. Now, for people who are in a situation where they're post-op or they are someone who can't really do high intensity exercise, this can be much more beneficial. So it all depends on the situation. And if you don't have the money to buy BFR, then it's okay, because honestly, as long as you stick to that high intensity training, you should be fine. So I'll list all of the research over here for you to read. And if you have any questions, let me know in the comments below. So let's go ahead and get started with talking about how to use BFR. So the basic idea is that you need to cut off venous blood flow completely and arterial blood flow to a certain percent. Traditionally, in order to find the arterial percentage that you need to cut off, you would perform a Doppler ultrasound and utilize a blood pressure cuff to cut off the circulation in order to find limb occlusion pressure. So whatever that number is what you use to take a percentage of to put into the BFR system and to perform the exercise with. Luckily, technology has made things so much easier, and all you have to do is put a percentage into the system and the BFR machine will take your limb occlusion pressure by itself and get the percentage in order to get started. Now, once you get that limb occlusion pressure, you want to go ahead and take a percentage so that the cuff can inflate to that level of occlusion. So for the arm, you want to make sure that the tourniquet is cutting off 30 to 50% of the arterial blood flow and 100% of the venous blood flow. For the legs, you want to make sure it's cutting off about 60 to 80% of the arterial blood flow and 100% of the venous blood flow. So you want to first start off by applying the cuff proximal to the muscle that you are training. So if you want to train the biceps, you want to put it right by the shoulder. If you want to train the quads, you want to put it high up on the thigh. And once you apply that, you want to start up up the machine and you are going to put the information in so that the cuff gets inflated to the desired pressure that you want. Once you are done with that, you take off the tube and you can start exercising and do squats and lunges, and you can perform anything else that you want to do. You just want to make sure to monitor your symptoms, make sure you're not having any adverse effects, and you can perform a full normal workout. Obviously, you don't want to be wearing this for an hours. Now, what does this mean for performers like dancers? Well, you can apply this for any of your exercises, including exercise from your conditioning classes. However, it's really not that necessary, but if you're afraid to use any weights or you don't want to do a high intensity exercise with weights, this might be a good option when you want to do some lower intensity exercise and still gain the benefits of building up your strength. You probably won't get that much hypertrophy, so don't worry about that. If you have any questions about the BFR technique, let me know in the comments or message me privately and I'll do my best to respond. Until next time, peace.